So recording has begun. And thank you, Darach. Dr. Darach O'Ciardha is joining me this morning. Today is the day that we launch our social prescribing project in East Limerick. It is a pilot programme for the east of the county. And with us this morning, I have Dr. Darach O'Ciardha, who has been an advocate of social prescribing in Dublin in his own practice in Tallaght Cross, and that is in Jobestown. So first of all, Darach, thank you very much for joining me.
Very welcome.
I guess the first question is, how long has social prescribing been part of your practice in Jobestown?
Yes, so we've been since 2016 actually. It started really because there was an awareness, I think, amongst the doctors and the practice nurse that a lot of the issues that were driving attendance or bringing people into us, actually, we were not in a great position to be able to help them because so many presentations have issues relating to the social determinants of health or other life stressors. So be it barriers around education or employment, be it issues with addiction or addiction in families, loneliness and isolation, even in a kind of a built-up area. These really powerful forces that were actually causing a huge amount of stress and unhappiness were very prevalent in our consultations, and I think we felt helpless. So it started with us very simply. One of our team, Brenda Nolan, is from Tallaght. She has a degree in social science, had done work with the Peter McVerry Trust and youth groups as well locally. I was keenly aware of a lot of the issues. So we embarked upon a little bit of an experiment, if you like, and so we set Brenda the task of really mapping out the resources in the area that were available to our patients. And after a couple of months, we felt we'd enough of a database, if you like, and then the way it worked in the practice was that if it became apparent to us that there was an issue that Brenda's social prescribing service may be able to assist with, then we would organise a face-to-face appointment with Brenda. Essentially, a needs assessment, a one-off needs assessment, and patients could, articulate what they were looking for, and then Brenda could do her best to match with existing services. And it really, kind of took off from there and hasn't changed all that much, So we've over 350 resources identified on our Amazing. Database. Yeah, and I mean that spans the whole gamut of needs really, and it would include helplines and so forth, but also very, very local services as well, community response projects, knitting groups, chronic disease support groups, the whole range. And so we will kind of regard a case open, if you like, as long as Brenda's still working with the individual to try and link them in with the service. And once they appear to be kind of successfully linked in with the service, then we kind of close the case. And very occasionally people won't kind of continue with it, and that's fine as well. But we have noted, well, a couple of different things from a doctor point of view. I think it's been really helpful for us to be able to offer something other than just, something in the medical model, something that's, medication based, or, I think it adds an extra dimension to the consultation. I think it allows us to connect maybe at a more at a deeper or more authentic level with the patient as well. And I think once you achieve that kind of connection, I think that's a very powerful thing. And I think there's a large, degree of satisfaction on a personal basis for the doctors to be able to, and for our practitioners to be able to, do things in that way. And I think for the patient, we've had, so many cases where a patient will feed back then in terms of their experience, in terms of, satisfactory linking in with, an addiction support group, or, knowing that, or realizing that there's a nitty group just across the road that they're now able to go to twice a week to alleviate isolation. And I suppose what you hope, and it's kind of an intangible thing in ways, but does all of this help create maybe a little bit more of a sense of purpose for the individual? And I think once you have that, there's a motivation to keep well, to keep healthy, to make positive choices, and that's ultimately good for health.
I'm hearing good for social connection too, to increase the confidence of the individual to make more connections in their community and perhaps be more engaged in with their community as a whole.
Absolutely. And I think, I'd like to think it's a start of like kind of a chain reaction in many ways, and just very small kind of baby steps made in terms of linkages between people and groups and organizations. And I think what we found as well is that there's kind of a positive feedback loop then as well. So as a practice, we're starting to become a lot more familiar with the support organizations out there, and they're likewise becoming more familiar with us. And one of our I think best collaborations is with one of the community, with a few of the community response projects. But we had an opportunity to go and visit them, and kind of pre-COVID, of course, but sat down around a table around lunch and found out exactly what they did, and they were able to ask questions of us. And we don't do that enough, but I think it's something that's incredibly valuable. And I think the less I suppose, or the more integrated I think a practice is in the community, I think the better. And then organizations who are doing really, really good work on the ground, I think will benefit then from increased throughput to their services as well. Because I think it's important for a lot of voluntary and community sector organizations to be able to demonstrate good activity levels as well. So I think there's an imperative there for all of us to be more connected.
Brilliant. Thank you, Darach. I think you have answered the 3 questions. I don't have to ask them. You've just covered everything there from your own perspective as a GP to how this would affect and how it does, what does it mean to the patient and how it affects your practice.
Just very briefly, because just from a GP point of view, one of the other things that we've noticed is that a lot of patients who have now passed through the social prescribing service would have been patients who would have attended really, really frequently. And we've found, looking back, that attendance rates in the practice amongst these patients have fallen by 25-30%. And I think that's an interesting thing from a practice point of view. And I think it points to actually people having kind of resolution or some additional response to their presenting complaint, something hopefully that's sometimes a bit more useful than we can offer. And I think it just points to maybe just a more kind of functional relationship, really, and so that we can as GPs kind of do our job and do our job well, but that patients are getting the help that they need as well.
Great, Darach. Thank you so much for joining me this morning, and I really appreciate the time you've given us, and I wish you the very best, and thank you.
I wish you all the best with your initiative as well. So lovely to talk to you.
Thank you, Darach. Thanks very much.